Hello, viewers. Good morning. How are you doing? I'm currently at work and I just started to discuss with you common diseases affecting poultry and how you can actually treat them with some common drugs that are available almost everywhere. So, be if either you're a starter or you're a professional, you know that poultry diseases can be severe. Diseases like Newcastle and Gumboro can wipe your flocks out in matter of days. Whether you have 1,000, 10,000, they can completely bankrupt you. So it is important to know what to do in what situation. Also, I'm going to show you how to identify these diseases and how you can treat them. So you're welcome. If you are here, please comment. Tell me if you can hear my voice. Leave a comment, leave a like, so that YouTube can also recommend this video to others so that they can join us in this live. Yes. So we are approaching the festive period, that is Christmas and New Year. Many of you want to keep birds. It is important that you know what to do in every situation. I've also talked about how to identify quality chicks, where to buy them, and how to identify chicks when they are sick, and what to do when chicks are sick. I've also taught you how to brood. You can check my channel. You can see I have many other videos on how you can brood your birds from day old to 3 weeks or 4 weeks. Yes, so you can go back and check my channel and you can see what I've done so far. But in this video, I want to concentrate and show you how you can treat birds when they are sick, how you can identify them and how you can treat them. Are you hearing me clearly? Let me hear. I'm at work, so the place is noisy, but I just have to make the video because I've been receiving complaints lately from my clients that they're having some mortalities on their farm, and I thought my people online too might be suffering from this. So I said, let me make this video, even though the environment is noisy and distracting. So if you see me moving time to time, please bear with me, and then I'll be here in this live. The first thing I would like to talk about is let's talk about Gumboro, a disease that affects birds between their first week of age to about 6 weeks of age. Yes, Gumboro is a very terrible disease. If you play with it, it will wipe your flock. So in Nigeria, we have Gumboro vaccine. I've not been to other African countries or any other country, but I know that Gumboro is a serious disease in Nigeria. So we have a Gumboro vaccine for it. I cannot show you vaccine because vaccines are preserved in the fridge. I cannot go to my fridge and give you a vaccine because it can affect the viability of the vaccine. But the vaccines are stored in the fridge. It has to maintain the cold chain. There's something we call cold chain that when you take a vaccine and drop on the shelf, it is going to spoil. So we keep vaccines in the fridge to preserve them, to protect the organism inside from becoming a disease-causing organism. You understand? So we prevent a Gumboro using vaccine, but sometimes vaccines fail. So what happens when vaccines fail? It can lead to a severe outbreak. So what do you do in case of an outbreak? Yes, what do you do? The first thing is to identify the disease. Without proper diagnosis, there's no treatment. You will just be spending money running after vet from vet to vet to vet and getting drugs. It's not going to work. But for what I do, because I know my client, and when someone comes with a presentation of high mortality at postmortem, that's you open the dead birds, to check what killed the bird so that you can treat the other birds. It is very important. So when you open the birds, in case of Gumboro, there are many things you will see. Most of the times you see that other parts are healthy, other intestines and intestinal parts are healthy, and then you notice that there's an inflamed bursa. We call it bursa of Fabricius. It's close to the anal region. You see that it's inflamed. That's the typical sign that these birds are suffering from Gumboro. But what if you can't do PM? When you see your birds, they are cold, their feathers are droppy and rough, and they are dying in high numbers. There are three things that could show you this sign. One is Newcastle, but in the case of Newcastle, most times you see them coughing. Yes, coughing and sleepy, and then mushy still. And then the second thing is E. coli. E. coli actually make them mushy and sleepy. And then the third thing is coccidiosis. Coccidiosis makes them also mushy and sleepy. So you have to observe these things. And then these things also come with other signs. Since I'm discussing Gumboro, let's focus on Gumboro. Gumboro, that is the only thing you see physically, the mushiness and the ruffled feathers. So what do you do in that case? I have a solution I use here in my clinic. Okay, so I don't know if you have Gumbo Endy in your location, but this is a solution for me. And also, I will tell you other herbal drugs that can solve this. Like this helps me manage Gumboro effectively. It's called Gumbo Endy. I think it's Gumboro and Newcastle because it actually takes care of Gumboro and Newcastle disease, which are very serious diseases here. If you don't have this, you can go for solutions like King's Herb. There's one we call King's Herb. I really don't sell it. It's called King's Herb. It's not common in this environment, but King's Herb actually helps. It takes care of this disease effectively. And I use this for 7 days. I prescribe this for 7 days, and then the birds get better. But I don't just prescribe this because most times when there's other infection sets in. So I prescribe this along with an antibiotic, maybe something like aerofloxacin. So these drugs I'm showing you, this is aerofloxacin. It's sold by Jubeli. You can see their logo here. It's sold by Jubeli. So this is their packaging. But there are many other aerofloxacin. Let me show you another one. Okay, yes, Kenflux. There's another one here, Kenflux, which is by Kpro. They are also a good company here in Nigeria. And there are many other companies that sell aerofloxacin. And this is aerofloxacin 20%. This one too is aerofloxacin 20%. And I find them to be effective. So a combination of these two drugs, aerofloxacin, have been known to solve my problem of Newcastle and of Gumboro. So these two drugs, these two diseases, I use the same formula for them, and it solves the problem. It cures the disease. So I advise you, contact your veterinarian. Make sure before you start a poultry farm, make sure your vet is in the picture, because when your vet is in the picture, they know the history of your farm. They know the possible diseases that could causing the mortality. So make sure you have a vet on your farm. It cannot be overstated. Yes. The second disease, which I just talked about, is Newcastle. For Newcastle, we also have a vaccine called Lasota vaccine and NDK for people that have layers. NDK. Now for broilers, we give Lasota vaccine maybe just 2 times, maybe 3 times. If you are leaving them to about 6-7 weeks, if you're leaving them to 8 weeks and above, maybe you have to give the Lasota almost every 6 weeks. This takes care of Newcastle. It protects your birds from Newcastle. But sometimes the vaccine also fails. When it fails, I also use a combination of Gumbo Endy, because the Gumboro, that's Endy is Newcastle disease, and the Gumbo is for Gumboro. So the drug takes care of Newcastle disease and Gumboro. Also, King's Herb also does that. It takes care of Gumboro and Newcastle disease. I've used both of them in the past. I've prescribed both of them in the past, and they work effectively. So I advise you and I recommend it for you to use. But always go with the advice of your veterinarian, since your veterinarian knows what they are doing and know the history of your farm. The next thing I want to talk about is coccidiosis. Yes, everybody that have kept birds before has once or twice come across coccidiosis. It's a very bad disease. How do you notice coccidiosis? Apart from the birds becoming mushy, you notice that they are passing sometimes bloody feces. So depending on what type of feces they are passing, there are different types of coccidiosis. Some coccidiosis just reside in the large intestine, some in the small intestine, and then you have to treat it accordingly. Yes, some of the drugs cannot go into the part that is disturbing the birth, so you have to use the right drug. And some of the drugs in coccidiosis, in treating coccidiosis, are not advised for layers. Some are just for broilers. For example, these drugs, Amprocox, is a combination of amprolium and sulfadimidine sodium. Yes. So this drug is not advised for layers because of the sulfur content. The birds that are laying, we try as much as possible to prevent giving to avoid giving them sodium. Sorry, to avoid giving them sulfur. Let me close the door so that we can all hear. Okay, I think we can hear each other better now. Is anyone with me? Can you hear me better? So this drug is used to treat coccidiosis. It contains amprolium and sulfadimidine sodium. And I just said that sulfur should not be given to laying birds because it reduces their production. So you avoid it. And this drug can be given to any birds of any age or even any animal that has coccidiosis. Also, I have another drug here by Kipro. This drug is called diclazuril. So different companies have different versions of their diclazuril, but diclazuril is used to treat coccidiosis, and it's very effective, especially when you have intestinal coccidiosis. I also have another drug here, which is you can see the name. I don't know if my camera is showing you very well, yeah, but it's called toltrazuril. Toltrazuril is a very powerful anticoccidia also. It treats your coccidiosis, especially intestinal coccidiosis. It just has a way of wiping all the coccidiosis in the intestine, in the birds. So they are effective drug. And I think I have other drugs also. You can use amprolium. Yes, amprolium is also very effective in treating coccidiosis in all ages and all types of birds, be it layers or broilers. It's safe for all of them. Yes, and then yes, those are the drugs that are used to treat coccidiosis and are effective. So if you have coccidiosis in your farm, how do you notice it? Brownish or reddish or bloody feces, and the birds will be feeling as if they are cold and working as if they are not interested. They don't want to work. Always contact your veterinarian, and when there's no veterinary service, you can get amprolium to treat your birds, toltrazuril to treat your birds. The next disease we are going to talk about is E. coli. Very important. E. coli. In E. coli, you may see the birds looking like this, but they walk fast and they eat very well. I don't like that disease at all. They can eat your bird, you can eat your food and still be dying. The birds that have E. coli can be eaten and still die. They can eat your food in the morning, in the afternoon, and in the evening, and then wake up in the night and you see 3 or 4 of them dead. You will not see reduced feed consumption, but you see mortality. So when that is happening in your farm, suspect E. coli. And let me just tell you a simple trick. I would have shown you a picture, but I don't have a picture right now. I would have shown you a picture of typical signs you see during postmortem. Postmortem, I've said, is when you open a dead bird to examine it and see what killed the bird so they can treat the other birds. When you open a bird that has E. coli, you will see the internal organs all white. There's a material covering the internal organs from the heart into the intestine, discovering them, whether it's layers, cheeks, or whatever. You see the whitish material covering them. That is a typical sign of E. coli. So you have to contact a vet, and where there is no veterinarian, you use drugs like enrofloxacin. This is enrofloxacin from Kipro. It's very effective. They use another drug, is the same thing, enrofloxacin. You can also use ciprofloxacin, but the drug I'm much more comfortable with is called colistin. Yes, I will recommend colistin for you. Yes, colistin is an antibiotic. Mostly it comes with amoxicillin, so it's called amoxicol or polyamoxil or anything like that. But just note the name colistin. If anybody hears me, let him say it in the comment section. Let me hear colistin. Colistin is effective against E. coli. Everywhere you see E. coli and you give colistin, most likely the birds will recover. You give it for 3 to 5 days, and that is all. The birds recover fully. Also, you have to place the birds on vitamins. Vitamins also give the birds the appetite to eat. Even though I said eat birds with coccidiosis, E. coli will eat your food, yes, but you still give them vitamins because vitamins don't just make your birds eat. They reduce stress. Vitamins like vitamin C are stress. They remove stress from these birds. Yeah, so you give them antioxidants and multivitamin because they are also antioxidants. And there are some drugs that you see them like this. This is from Albion, the company here in Nigeria. And what are the contents? Let me read them out for you. The contents include citric acid, ascorbic acid, malic acid, gamalic acid, alpha tocopherol, selenium. These are the contents. You can see there are many vitamins inside. There are amino acids inside also. So this one is called Albion Immune Booster. It boosts the bird's immunity by providing these antioxidants so that the birds are healthier. It removes the antioxidants, making the birds healthier to fight provide them with good immunity to fight off the infection. And immunity is very important when you are dealing with the disease. It helps the birds in fighting the disease. What next? Is there any disease you want us to talk about? Because these are the major diseases in poultry that I just discussed, which include gumboro, E. coli, coccidiosis, and Newcastle. Let me add one, which is salmonellosis or salmonella infection. Salmonella is a very bad disease also, especially in layers. When your birds are laying, suddenly they just stop production, and you open the birds and you see that there's an egg that broke in their abdomen. There's a broken egg in their abdomen, and then you see some eggs are not formed. The small eggs that are supposed to be there are not there. They are small on they are broken. They are misshaped. We call it misshaped ovaries. Yes, this is a typical sign of salmonella, and the eggs will be smelling everywhere, and the birds will die. The bird will die. So this is one of them. We call it, in chicks we call them mushy chicks. You see them mushy. They will be doing the same thing like in coccidiosis and in E. coli. Just that in E. coli you will see them eating very well. In coccidiosis you see reddish or brownish too, but in salmonella you see them mushy. They will not eat. You have to treat them also. And luckily, most of these antibiotics I called earlier can take care of Newcastle, gumbo, and E. coli, and still salmonella. And for you to be safe, you combine it with one of these herbal drugs that I mentioned, gumbo ND, and gumbo ND or King's Herb, not both of them. Just choose one. Yes, and that takes care of the disease in most cases. And I said always contact your veterinary doctor or veterinarian and get the best advice from them. Now, there are some drugs that we give poultry time to time for preventive purposes. We call it prophylactic treatment, especially when you have finished brooding and then you finish vaccinating. So there's a free period between week 4 and week 6. We give drugs like oxytetracycline, 5%, to just help the birds convert feed better and clear any bacterial load that is building. Oxytetracycline is a very common antibiotic. Sometimes feed producers add it in their feed to boost feed conversion. Yes, they add it to their feed and to boost feed conversion. Also, you can see that this is called egg boostilin. Can you see it very well? Egg boostilin is by Albion, and it's also important because I've used this, I've recommended this, I've prescribed this for for poultry farms that were having bad production, and it turned the farm around. It's a very good drug. It contains oxytetracycline. You can see oxytetracycline here again. We are giving it to layers because it's a very common antibiotic and it's safe. You understand? So the withdrawal period for egg is 0. There's no need of withdrawal according to the manufacturer. But the withdrawal period for meat is 1 day. What are the contents of this drug? This drug contains oxytetracycline, about 5,500 milligrams. Okay. Vitamin B2, vitamin A, vitamin B5, vitamin D3, vitamin B6, vitamin E, B2, B12, K3, and yes, that is it. That is the content of this drug, and it's very effective when used properly. And when the birds are healthy, just drop in production, which could be as a result of changing feed or things like that. Also, there's egg, Terra egg promoter, same producer. And what are the contents of this drug? I just want you to observe the contents of this drug. Vitamin A, second one is cholecalciferol, vitamin E, oxytetracycline again. You can see why I talked about oxytetracycline early. Yes, talk to your veterinarian and give your vet oxytetracycline once every month to boost. That is it for diseases. Now let's move to something. As you can see, I have egg here. This egg is from one of my clients' farm. They are doing well. The eggs are large. Forget what you are seeing in the camera, but they are actually very healthy and good eggs. So why did I keep these eggs here? These eggs are for sale, and I also want to use it to show you something, to tell you something, how you can increase production on your farm, because I know many of you are suffering from low production. What could be the cause of your low production? Many things. Many things could be causing low production in your poultry farm, and it's important you identify them. In this video, we'll talk about the common things that cause low egg production in poultry, and how you can combat them, how you can solve this common problem in poultry farm. If this video is making sense, it's just normal, it's just good to give me a like to encourage me, and then maybe leave a comment in the comment section. But then I'll still continue, even if no one will like it, because I know somebody will find it important. What makes birds not to lay or not to lay properly? Apart from these diseases I've mentioned, there are other things. But the common things that makes birds not to lay properly is diseases. So you have to keep your birds healthy. And how do you keep your birds healthy? Proper vaccinations, following a good vaccination schedule. What is the vaccination schedule? The vaccination schedule is a plan that shows you what vaccine to give at what day. For example, the vaccination schedule I use for my client's farm rotates around Lasota. Basically, when birds start laying, there's no vaccine we give them again. Here in Jos, I am the city of Jos, Nigeria, Plateau State, Nigeria, and then the common disease here is Newcastle and infectious bronchitis, and most of these vaccines comes as Lasota and IBD. They come together. You understand? So once we give the Lasota, it takes care of both the diseases. So it's important to follow a good vaccination schedule, which I just said I give my clients instruction to give Lasota every month. By giving Lasota every month, they don't see Newcastle on their farm. And Newcastle is a very common disease that reduces production or crashes production to 0 you don't want to experience Newcastle on your farm. So give Lasota vaccine every month. And how do you give this vaccine? Since Lasota is given every month, your vet can come to your farm and give the vaccine. It's very important because vets and paravets, most of them, I can't trust paravets like that. I'm speaking for myself, I'm a veterinarian. But if it's a paravet that is trained under a vet, I've trained many paravets and I trust them to be able to administer vaccines like Lasota. How do you give this vaccine? Imagine this is a vaccine, you collect it in a flask, in an ice container, in a container that preserves the cold chain. If you are taking it home, you put it in your fridge and make sure it remains in your fridge. On the day of vaccination, you remove it, you open the vaccine, you remove the contents, and water. The quantity of water is very important. If your birds take 50 liters of water a day, you give them only 10 liters of that. You mix the vaccine inside only 10 liters of water and share the vaccine for them before you give them water that day, before you give them the other 40 meals or 40 liters of water. Why? Because we want these birds to take that vaccine immediately, as fast as possible. As we said, if temperature for long, they lead to disease very early. Let them take it very early. And we achieve that by starving them with water from yesterday. So if you are giving your birds vaccine this morning, you starve them from water, you remove their water yesterday evening, around maybe 7, 8, so that this morning they'll be very thirsty. Now, by them being very thirsty, you have created an avenue for them that they rush to drink water. Yes. So it's important that we get them ready to drink water early in the morning, so that when you just give them the vaccine, you see them rushing to take it and they will take it. That is all. You're giving them the vaccine for that month. So you wait till the next month. That is for Newcastle. And if your birds are free of Newcastle, they'll do well. And if you are dealing with adult birds, since we are talking about layers, they're adults, there's something you notice when they have Newcastle. They cough. If you stay, that is why it's very important to listen to your birds. Listen, just go close to the window of your poultry and listen and observe. Birds that have Newcastle are not free. They don't eat as much as possible, and you'll be hearing them sneeze. I don't know how to mimic them, but you hear them sneeze as if it's just abnormal. When you are there, you notice it. So observe your birds and make sure they are healthy. The second thing that reduces production is also a disease. Disease like coccidiosis, E. coli. Just make sure your birds are healthy. A healthy flock will always give you good eggs if other factors are met properly. Now let's talk about feed. Feed is a major cause of drop in production. There are farms I consult for, and I ask them, what is wrong? They said, there's nothing wrong. They won't tell you there's nothing wrong. Oh, the birds were doing well, and all of a sudden they they drop in production. But I go further because I have experience in doing this. I've been doing this for more than 8 years. Yes. So I've been keeping birds for more than 10 years. So I know when someone is not telling me giving me the correct information. But if you go to your vets, always give the correct information, the complete information. Why? Because it helps the vet to know exactly what is wrong with your bird. Imagine your birds are not laying very well, and you know that you changed feed yesterday. You go to a vet, you did not include that in your complaint. You just don't want to say it. The vet will give you drug for disease while it's not disease. It's because you change your feed. Immediately you change your feed. Any feed you change, birds will drop production. Why? Because they are not used to that feed, and most of them will not eat that feed. And if they don't eat food, they will not give you eggs. No matter how good the feed is, you have to change it over a period of time, and then they have to pass through that change and become used to that feed, so that all of them are eating that feed, then they can produce. So change of feed can cause a drop in production. How do you change feed, you may ask? For you to change a feed to your poultry, you have to do it systematically. If you have 500 birds, you have to give them at least 2 bags of 25 kg feed a day. So for you to change feed, Let's say you are using hybrid feed and you want to change to vital, you change it. Give the normal feed you have been given 3/4 and introduce quarter of the feed that you want to change and mix them together. Give them that day. The next day, you introduce half, and mix it and give them. The next day, you bring 3/4 of the feed you want to introduce and quarter of the feed you want to change and mix it and give them. And then the fourth day, you would have changed it completely. So you now bring the whole new feed and introduce them. When you do that, you notice there's just a little fluctuation in their production, and the birds will eat and produce very well, especially when the new feed is a very good feed. So your choice of feed will affect your production, your best production. So always and always go with the best feed. If you are producing your feed, make sure you follow all the necessary parameters. Check all the necessary parameters. Do proximate analysis of the raw materials. When you finish making the feed, also check to see that the feed is of best quality and meets the standard for layers, because layers are garbage in, garbage out. If you give them high quality feed, you will produce high quality eggs for you, large eggs, consistent eggs. But if you give them poor quality feed, they are definitely going to give you poor quality eggs. What is the next thing that causes reduced production? Another thing that causes reduced production is yes, common light.